Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Managing pharmaceutical spend is a high priority of every health system pharmacy. The road to success is smoother when traveled with trusted partners. Joining me today to talk about such a journey are two pharmacists from St. Tammany Health System, Dr. Wendy Talley, Director of Pharmacy, and Dr. Ashley Wilson, Pharmacy Manager, as well as my Vizient colleague, Dr. Tony Huke, Pharmacy Executive Director in Advisory Solutions. I'm Gretchen Brummel, Pharmacy Executive Director with the Vizient Center for Pharmacy Practice Excellence, and your program host. We are recording on-site live at the 2022 ASHP Mid-Year Clinical Meeting. Welcome all of you to the podcast.
Thank you, Gretchen, for having us. We're really excited to be here.
Yes, thank you so much.
Yeah, thanks, Gretchen. Really appreciate the opportunity.
Wendy and Ashley, tell me about your role at your organization and a little bit about your backgrounds.
I'm Wendy Talley. I'm the Director of Pharmacy at St. Tammany Parish Hospital. We're also part of St. Tammany Parish Health System. Started out almost 30 years ago as a staff pharmacist, IT pharmacist. Then 7 years ago, took on the role as director and everything that includes.
Wonderful. Thank you.
I'm Ashley Wilson. I've been at St. Tammany for a little over 8 years. I started out there as a student and worked my way up. I'm currently the pharmacy manager, but I was a clinical pharmacist and clinical coordinator before that.
Thanks so much. And Tony, how about you? What do you do for Vizient and what were your roles prior to joining our team?
Thanks, Gretchen. I'm a member of the clinical pharmacy consulting team, so I work with our members on clinical initiatives, cost savings opportunities, formulary management. Prior to coming to Vizient, I was a member hospital for over 18 years where I served various roles: internal medicine pharmacist, clinical manager, residency program director, and ultimately director of pharmacy.
What were some of the challenges and successes you previously had at St. Tammany around pharmaceutical spend?
Every single day is a challenge about the spend. And it just gets more and more over time with the new drugs and the cost. Probably our biggest success started in 2007 when we started our antibiotic stewardship initiative. We really did not know exactly where that was going to take us. We started focusing on 4 drugs. It was huge in the very beginning, but now we're more in that maintenance phase where we're keeping our cost per patient day down. And that's probably, I think, one of our biggest successes. Everything else are just small initiatives that may be $5,000 here, $10,000 there, and just over time that adds up.
Ashley, anything to add?
It's just a balance as far as stewardship activities along with patient care, because at the end of the day, it's about patient care and making sure that we have the right treatment for that patient. If we can have added savings on top of that, then that's always a great thing. But it's really patient first and then trying to focus on those stewardship activities for right patient, right care, and right drug.
That's always our focus, patient care first.
Great approach. So it sounds like you had some initial successes and then Tony was brought in to lend a hand. Tell me about that.
Our hospital is always looking to partner with somebody that can take an overview of what we're doing and help us do it better or enhance what we're already doing. Where Tony came in, Ashley and I are so busy in the day-to-day environment in putting out the small little fires all day, we don't really have a chance to take a higher level look at where the opportunities lie for us to save money. That's really where Tony has been just invaluable. He came in and not only found opportunities that maybe we had identified but hadn't had opportunity to expand on, get the research to provide to our formulary committee to make those changes, or just plainly identify best price NDCs or something very simple change that we can make immediately. He was able to look at that and give us an overall picture of where we could do better and where we don't have that opportunity to take that time.
Ashley, what was the experience like for you?
It was a great experience to have somebody come in from outside. You definitely have to be open to the suggestions that are being provided, because a lot of times it's not about necessarily you, but it's about the process and your workflow and how can we make that better. As long as you can take a step back from that to make sure it's about the process and what can we do better.
You definitely have to be flexible and hear what the opportunity is before you say no, can't be done here.
That makes a lot of sense. Tony, what opportunities did you see when you came to the organization?
There were some simple things early on that we were able to accomplish. Best price NDC. St. Tammany was experiencing quite a bit of product waste with inhalers and insulins and other bulk products. We were able to just a simple solution of buying a heat sealer and having those products be dispensed to the floor. And if they were returned unused, they could be returned to stock and reused for another patient. The amount of waste that we saved early on was pretty significant from a financial perspective. And so that was one of our big wins early. Then we got into more in-depth practice-based activities like calcitonin and restrictions on use, and was able to provide them the resources they needed to make those opportunities viable.
What was your approach to providing support to the organization?
First, I had to identify the opportunities and then assess the needs, be able to provide anything that the St. Tammany team needed to help implement those opportunities. Sometimes it was evidentiary support. Sometimes it was contract opportunities that weren't available, anything that we could find and anything I could do to support them through the process to make them implementable.
The big things that you did for us, Tony, were the best practice evidence-based information that we needed to present to formulary and keeping us on task, putting us at a point where we had a deadline, a way to move forward, the information you needed from us to keep us going and the initiative going.
We set up a routine meeting cadence every other week, and many of those meetings were short as there weren't updates, but the fact that we had them routinely really set check marks throughout the process that, oh, we've got a meeting coming up. Let's try to finish this or accomplish this, get this document out, whatever it might be. So it's been a great partnership.
So some of that support with project management and just keeping things on track, because it sounds like you all have a lot of other things going on. What were some of the wins that came out of this collaboration between the two groups?
Before we get to the wins, the one thing I do want to say is that Tony's background, with the fact that he was actually a pharmacy director before, we could talk about that workflow, and he really understood where we were coming from to say, like, well, I'm not sure that would work. And he could help brainstorm other ideas to figure out, okay, well, what if we do this instead? Because being in the pharmacy field himself, he could speak to that.
His experience in the role really we just really meshed very well. From day one, we were just talking the same language, knew what we wanted to do, knew how to work together to get it done. And he understood the pressures and the outside things that were going on with us and how to navigate that and help us.
It's fantastic to hear about that pharmacist to pharmacist connection, that peer-to-peer collaboration. That does make a lot of sense. What were some of the wins that came out of this collaboration since you were able to work so well together right off the bat?
We had a lot. We did the bulk package waste, and that was an easy one. But even simple things, best price NDCs, looking at what products we were purchasing, is there a cheaper alternative just by changing generics? That was really good and well received. Also, just taking the time in the meetings, because a lot of times you don't have enough hours in the day, but we would have extra time and we would just go through and say, okay, let's just do it now. Even with TB skin test or education, if there was something that Vizient didn't already have, it was something, we have a couple of new initiatives that Vizient hasn't completed yet. So we just took the time right then and there. Let's do the education together and knock it out.
I would say another huge win is this was out larger than just a Vizient collaboration with pharmacy. It was our whole hospital. There were multiple processes going on from HR and contract review and different things like that. But Tony helped us. Pharmacy always was the first to have any initiative completed. We also had set a rough goal for savings for the project. We not only met that ahead of time, we exceeded that. Our part of it, pharmacy was just shining through the whole process from my whole hospital perspective. I was always getting great reviews from our executive team for how we went through this process together.
That's a really good point. Having that collaboration and chemistry up front puts you out front in terms of your savings and puts you at the top in terms of comparing yourself to some of those other groups at the organization.
Yes, we did. We saved more money than any other department in our organization.
Well done. What else do you want our frontline pharmacists to know about what to expect when consultants are engaged with an organization?
Most importantly, everybody will pause and say, oh, I really don't want to do that. I really don't want somebody coming in here and looking over my shoulder and telling me I know my organization and my pharmacy better than anybody else. What I would say to them is be open. There's always an opportunity for a different set of eyes to look at what you're doing and either help you do what you're doing better or give you a different way to go about it. Now, you do know your organization the best. You do. But somebody taking a look from the outside can give you a different set of eyes, different opportunities. You just have to be open to it, and you will really enjoy the experience, and I think you will come out better for it.
Ashley, your thoughts?
You got to take yourself out of it. It can't be personal. It's not about you. It's just about how can you make your pharmacy better. So you really do have to have that open mind going into it.
You're also building relationships for the long term. This is a relationship with Tony that we're going to have for a long time. We're going to reach out to him whenever we have issues and ask for his guidance. And he can do the same with us.
Happy to help.
You've got him on speed dial, huh?
Yes, we do.
So what were some of the barriers or challenges with this project?
Our time constraints was a big barrier. trying to meet the needs to move an initiative forward, that Tony would present us with things and then we didn't get a chance by the time our next meeting came around to do anything with it. That was a huge barrier. The fact that we have too many commitments, too many other meetings to focus on that. You really have to commit the time to it to prevent that from being a barrier. He worked well with that and kept us going.
A lot of our initiatives also included other departments. So for example, trying to do different things with anesthesia and in the OR. So it really was not just, oh, well, what do we think from a pharmacy perspective, but we have to talk with anesthesia. Are they going to buy into it? Can we get them the data that they need? Sometimes that would just take time in and of itself. It's not something that you could have all this cost savings and change overnight. It does take time.
Most of them are not quick fixes. It does take an investment in time. You have to convince the stakeholders that they want to agree with you, whether or not they think they do or not. If pharmacy owned everything about it, then it would be a lot faster. The best price NDC, that was very quick. The bulk waste reduction project, which was a huge success, that was solely pharmacy.
And how did Tony help with some of those challenges?
He just gave us good advice on how to approach it. He would tell us a lot of time, when I was a director, I did this and this worked very well. And so we just took that advice and we kind of worked it out with our staff.
Any final thoughts from the group?
I just want to thank Wendy and Ashley for their collaboration and their hard work. They were amazing partners, and I really appreciate the work that they put in. It's a relationship that's going to last much longer than the engagement.
I agree. It was just a pleasure to work with you, and we look forward to more in the future.
It's definitely an amazing opportunity. So thank you, Tony, for all your help. We greatly appreciate it.
Well, we really appreciate you all joining us here today. Thank you so much for sharing your perspectives and expertise. I'm so glad you could be here.
Thank you so much. It has been fun.
Yes, it was a pleasure. Thank you.
Thanks, Gretchen.
And listeners, please join us for more Verified RX podcasts. Subscribe today, like us, and send us your comments. We'd love to hear from you. Verified RX is your prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. I'm Gretchen Brummel. Thanks for listening.